Hi, good evening. Today we are going to do a head, neck, and face video assessment. So I'll do a room scan. So, Mr. Montagna, I will ask you a few health questions regarding your um, uh, head, face, and neck. Did you have any neck injury, trauma, and head, neck, and injury trauma from the past?
No,
Okay, and did you experience any dizziness, headaches lately?
no.
Okay, so I'll proceed with assessing his head. So checking now if his head is appropriate for his size, his weight, and his height. It looks like it's a normocephalic, which is normal. And now I will palpate your skull and head, checking for any protrusions, depressions, and lumps. And now I'll check the temporomandibular joint. So can you please open your mouth again? Okay, so I was checking for any crepitus, limited range of motion, and any tenderness. So after checking that, I will check the facial expression. Checking looks like his facial expression is appropriate for the event. I'm checking now for the symmetry of his face. So can you please raise your eyebrows? Checking for the symmetry of that, and also his eyes, the nasolabial folds, and the sides of his mouth. So if there are any asymmetry of his face, the cause of that could is the cranial nerve number 7 damage, which is possibly from a recent stroke or a Bell's palsy disease. So now I'm checking for the neck, and I'm checking any swelling of his parotid glands. Oh, is he still on? Parotid glands and swelling for the parotid glands, salivary glands enlargement, and the thyroid glands enlargement, which is here on the sides of the trachea. And then assessing now for the range of motion. So can you please turn your head to the left? Oh no, yeah, and to the right, and then extend your head to the back, and then to the chin to the chest. And can you please move your head ear to shoulders? Yeah, as far as you can. Okay, thank you. So now I will check. That was just assessing for the range of motion of his neck. And any problem with that?
No.
Okay, and now I will assess for the spinal accessory, and for spinal accessory is cranial nerve number 7, and checking for the cranial nerve number 11, spinal accessory. So I'm checking now for this muscle strength. So can you please shrug your shoulders? Okay, and then can you please turn your head to the left? Checking for any resistance, and here, okay, resistance. And yeah, there is symmetry when he laid down his shoulders, and I did feel the resistance. So I will now assess for the lymph nodes of his neck. So I will start with the preauricular here using the pads of my fingers, and then that's the preauricular, and then postauricular, and then the submental, under the chin, submandibular, jugulodigastric, and then now checking for the anterior, superficial anterior lymph nodes, and then the deep cervical chain, which is on the sides of the trachea down below, and then the supraclavicular. Can you please shrug your shoulders? So that hollow, I'm checking for the supraclavicular lymph node. So can you please turn your back? Thank you. So I'm checking for the occipital lymph nodes here on the soft spot, just on the base of the skull here. And down below, in between the cervical spine is the posterior occipital lymph nodes. So thank you, Mr. Michael. Can you please face forward or in front? So with the lymph nodes, the lymph nodes, did you feel any tenderness with that?
No.
No. Okay. So with the lymph nodes, the lymph node should be soft, should be movable, discrete, and non-tender. And if I see any abnormality of his lymph nodes, I will assess for the location, the size and the shape, the delimitation, if it's matted or discrete, and if there is any tenderness, and the mobility, and also yeah, that's it for the mobility and the consistency. So that ends the head, face, and the neck video assessment. Thank you.